Yo, Mike. Mike, what are you doing, man? What are you doing?
I have lupus.
You have lupus?
I have an autoimmune disease. I have to attack my body.
No, man, that's not how it works. Who told you that?
There's like a doctor guy at Taco Bell. I was just yelling really loud
You're gonna
about
talk
how I
about
liked.
for your medical advice?
Well, yeah, he said I was lupus or something, and after yelling a bunch, and I looked it up, and it's an autoimmune disease. I gotta attack myself.
No, man, that's not how it works.
What are you talking about?
Well, you want to know how autoimmune disease works?
Like, not particularly, but okay.
All right, I think you need to know.
Sure.
All right, let's go.
All right.
Hematocytoblasts in the red bone marrow give rise to lymphoid cells. Some lymphoid cells migrate to the thymus where they will differentiate between helper T cells or cytotoxic T cells. The cytotoxic T cells go through a selective process in the thymus where they learn how to recognize self cells from not self cells, such as bacteria or other pathogens. Normally, a T cell will go through positive selection, where the T cell must recognize self or it will go through apoptosis. In the case of autoimmune disease, some T cells are able to bypass selection and will most likely attack healthy tissue within the body. When cytotoxic T cells attack healthy tissue, many problems can arise, such as pain, swelling, inflammation, or more serious issues such as degradation of nerves and vital organs like the heart and lungs. Because autoimmune disease is considered hyperactivity of the immune system, the regulatory T cells are unable to stop the attack, and medications are required to suppress the immune system response.
Well, where were we? The voices, that was you, me, the others, but more importantly, what does this mean when the cytotoxic thymus cells attack specific cell markers leading to very different and specific autoimmune diseases? What happens then, huh? Are you saying this can't be an autoimmune disease?
That's exactly what I'm saying. Michael, thank you so much for your inquiry. Here's how it works.
Rheumatic fever is an autoimmune disease that is a response to untreated strep throat. If infected with the group A Streptococcus bacteria and it is left untreated for 2 to 4 weeks, it can develop into rheumatic fever. Antibiotics are required to prevent the body from hyperactivating the immune system. Rheumatic fever is an inflammatory disease that attacks organs, especially the heart. If it is left untreated, it can lead to rheumatic heart disease. This can cause damage to heart valves and can lead to heart failure. Atrial fibrillation, which is an abnormal heart rhythm with rapid and irregular beating of the atrial chambers, can also occur. Atrial fibrillation damages the SA node and the pacemaker cells. Another consequence of rheumatic heart disease is endocarditis. This is when the inner surface of the heart gets damaged by an infection and can result in heart failure, stroke, and kidney failure. Psoriasis is an autoimmune skin disease where the growth of skin cells is sped up. T cells will gather on the skin, causing silvery, scaly patches to occur. These patches are typically found on the scalp, face, mouth, elbows, lower back, palms, fingernails, knees, soles of feet, and toenails. Multiple sclerosis is when the immune system damages the myelin sheath, which is what surrounds and protects nerve cells. This causes messages between the brain and body to slow down or to be blocked completely. The result is pain, blindness, visual disturbances, muscular weakness and spasms, trouble with coordination and balance, sensations of numbness and prickling, and thinking and memory problems. Lupus is an autoimmune disease that causes inflammation in the skin, blood, nerves, joints, and internal organs like the kidneys, heart, and lungs. There are many symptoms of a lupus flare. Some of them are fatigue, headaches, painful or swollen joints, a butterfly-shaped rash will occur across the cheek and nose, and hair loss. Patients also have sunlight sensitivity or photosensitivity where they cannot be exposed to excessive amounts of UV and other light sources. The light exposure could cause a flare to occur, so time in the sun will be limited and sunscreen must be worn. A fun fact about lupus is that it affects dogs as well. This handsome man's name is Gunnar, and this past year he was diagnosed with lupus. These pictures that he did not want to sit still for were taken during a flare. As you can see, the skin around his muzzle turned pink and was raw. He also experiences hair loss, and his eyes become swollen and hurt to the point where he doesn't want to it pains him to open it. The other cutie in these pictures is Gunner's brother Toby. They are from the same litter, and Toby does not have lupus. The flares are controlled with medications, so the proper levels have to be figured out. And then this is a picture of Gunner towards the end of a lupus flare, and as you can see, the pinkness and swollenness of his eyes is significantly reduced and or completely gone.
Dave, with so many diseases, so many different outcomes, it must be really complex to treat myself. What can I take to help?
Mike, right now you need some Prozac, but people with autoimmune diseases, luckily for them, there's a plethora of different types of medications that they can take for their condition. Let's take a look at that.
There is no cure for autoimmune diseases, but there are many treatments. For example, hormone replacement is used to replace destroyed hormones in some autoimmune diseases. Insulin is replaced for type 1 diabetes, and the thyroid hormone is replaced in Hashimoto's disease. Drugs can also be used as a treatment. Corticosteroids can be used to control inflammation by controlling an overactive immune system, but this suppresses the whole immune system. NSAIDs, or non-steroidal anti-inflammatory drugs, are used to ease pain and swelling. DMARDs, or disease-modifying anti-rheumatic drugs, suppress an overactive immune system and reduce pain and swelling. They also reduce long-term damage to joints and organs. Biologics, or immune response modifiers, target a specific attack rather than a whole-body attack. Scientists are experimenting with stem cell therapy treatments, including reprogramming cells to replace damaged tissue, or replacing the immune system altogether by replacing the bone marrow. They are also trying to activate regulatory T cells, induce self-tolerance with vaccines, and destroy self-reactive immune cells by targeting antibodies against them. Treatments try to block the action of cytokines with antibodies against them, or to block co-stimulatory molecules required to activate effector cells. It's challenging to block the autoimmune response without blocking other necessary immune functions.
All right, Mike, so do you feel like you learned enough about autoimmune diseases now to be able to take care of yourself going forward?
Well, other than a backup pharmaceutical shopping list, just in case my symptoms return, I did learn that autoimmune diseases are quite serious, multifaceted, varied, and need to be treated with professionalism and knowledge in order to effectively combat them.
Exactly.
Okay.